a woman at the centre of last year's Northern lockdown claims she felt bullied over how the government ministers treated her during that time. The woman had been accused of cheating her way across the border, but police have ruled out laying any charges against her, saying there is insufficient evidence to support the claims. The COVID-19 Response Minister, Chris Hipkins, is with us this morning. G'day, Minister. How are you?
I'm good, thank you.
That's good. Hey, why don't you just say sorry to these women? Why don't you just say sorry?
Look, I haven't actually seen the report on that yet, so it is something that I will go and have a look at and see whether any of the information that we were provided at the time was wrong. I haven't had a chance to do that yet, but I will.
Because yesterday you said you wouldn't apologise.
Yeah, like I said, I haven't had a chance to look at the information yet, but I will certainly endeavour to do that.
Because, I mean, it's not a good look, slagging people off. Let's turn the coin the other side. What evidence did you have that they had been dishonest?
Look, we're going back a long way, and I'll have to go back and find all of the notes about the information that we were given at the time. I would note, however, that police indicating that there's insufficient evidence for prosecution doesn't necessarily mean that there's not evidence at all. It just means that the threshold for prosecutions is a very high one.
Shouldn't the threshold for maligning a member of the public be high too?
Well, we share the information that we're given at the time and the information that's available at the time so that people can understand what's going on and why we're making the decisions that we're making. We have actually been quite careful through the outbreak not to unfairly criticise people. That doesn't mean that information that's shared hasn't led to the people being criticised, but generally speaking, it hasn't been us that's been doing that.
Yeah, I mean, because you obviously didn't want it to look like you had a loose border, right? So it was convenient to go after these guys.
Well, like I said, I haven't had a chance to have a look at it, but at the time, I think I recall being pretty careful about what judgment we were making on people at that time. We were trying to be as open as possible about what information we were getting about what had happened and what the risk around that was. And I think that that's absolutely the right thing to do. I do acknowledge that sometimes leads to other people passing judgment and making criticisms, but the Be Kind message is one that we've been sharing for a reason.
Do you know about the cost at the moment to businesses and to, well, even healthcare, the likes, from the isolation rules, as opposed to, like, if we reduce the isolation rules down to, say, 72 hours with a negative test, something like that, do you know how much worse the outbreak would get?
We haven't got information on a 72-hour isolation period. We've got good information on a 7-day isolation period, which was the one that we announced yesterday. And we do know that there'll be a marginal increase in risk associated with that, but it's offset by quite a significant benefit in terms of people being able to go back to work and get back out and about again. The vast majority of whom won't be infectious by that point, but that's not to say that there might not be a small group, a small percentage who are. But 3 days is not something that I've seen any evidence or any modelling on.
Have you asked for any?
They keep it under review all of the time. What we do know is that
you have asked for some?
Well, we're picking up the majority of cases within 7 days, but we are still picking up days at around that sort of day 6, day 7.
Do you know what the long-term impacts will be from the healthcare system being shortchanged in terms of staff by the isolation rules? The healthcare system is coping remarkably well. That's not to say, like every part of the country at the moment, that they don't have people who are currently unable to go to work because they're isolating. And the reduction from 10 days to 7 days does mean that for those people who have recovered after 7 days, they'll be able to get back into the workforce earlier. We are still asking people, though, who haven't recovered and who are still showing symptoms after 7 days, we're asking them to stay home until 24 hours after they stop showing symptoms, because that's one of the simple things that people can do to help reduce the risk of even more people being infected and even more people having to isolate. Do you know when you'll have the advice, or have you got it already, on when tourists will be allowed in?
We're working our way through that at the moment, and the Cabinet's yet to make decisions on that. We have indicated that we think that for visa waiver countries, we're likely to be able to bring that forward, and we hope to be able to make decisions on that during this month and provide some clarity around that.
Okay. Hey, just very quickly, the hospitalisation, the numbers in hospital, it looks really frightening. It's, 700-800 people in hospital with COVID, and I think that really scares people. But they're not all there sick with COVID, are they? No, that will include some people who have gone to hospital for other things. The hospitals typically are testing just about everybody who walks in the door at the moment. And so some of them may even be mildly or even asymptomatic for COVID-19, but they're in hospital for another reason.
Some of them could have been...
There aren't a significant number of people in hospital with COVID. There are, and that is putting our health system under pressure.
Yeah, but do you know how many?
I don't have that data. It's one of the things that we've asked the health system to adapt the way it records this so that we get a bit more visibility of that. Now, that takes a wee while for them to implement those sorts of changes, but we have asked if they can do that so that we can see that.
Yeah, I asked them as well, and they said they don't have a way to do it. I mean, 2 years into a pandemic, you'd think they would, but they don't. But they look at overseas examples, and they reckon it could be as little as 60% of the people, people in hospital, are there because they're sick with COVID, as opposed to other people who might have had a car accident or something else and happen to test positive.
One of the measures that we look at for the degree of severity of hospitalisation are the number who require ventilation or who require ICU treatment. We have 19 in ICU as of yesterday. That is going up. That's a number that's going up. But we'll keep that. That's one that we're following very, very closely because it does help to give us an indication of the sort of severity that the health system are dealing with.